Hello and welcome to the Anxiety and Depression in Students with ASD in the General Education Classroom webinar. I'm your presenter, Cheryl Checkers. Before we get started, I wanted to take a minute to thank both FAU CARD and PEPSA for sponsoring this webinar. I'll be providing you with a code for the CEU credit towards the end of this webinar. So a little bit about FAU CARD. They provide expert consulting, training, and support at no charge for all people across race, ethnic, and gender groups with autism and related disabilities, their families, employers, and professionals in community and government agencies serving them. Their vision is to provide support and assistance with the goal of optimizing the potential of all people across all race, ethnic, and gender groups with autism and related disabilities. CARD serves 5 counties. They serve Indian River, St. Lucie, Martin, Okeechobee, and Palm Beach County. They have 3 offices. They're located in Boca Raton, Jupiter, and Port St. Lucie. A little bit about me. I'm Cheryl Checkers. I'm a licensed mental health counselor. I am in private practice. I specialize in working with children, teens, and adults with ASD who also have a dual diagnosis of a mental health disorder. My past experience includes being clinical director for the National Alliance on Mental Illness, and also I was a past clinical support specialist for FAU CARD. So we're going to get started with the presentation or the webinar. Anxiety and Depression in Students with ASD in the General Education Classroom. Today, I'm going to be focusing on post-secondary classroom students. The learning objectives: identify the common symptoms of anxiety and depression in secondary students with ASD, and also identify basic strategies that can be used to support students with ASD who experience anxiety and depression in the classroom. So I'll be going over not only how anxiety may present in the classroom for your students with ASD, but also going over diagnostic manual diagnoses of anxiety disorders and depressive disorders, and also talking about some basic strategies that I'm hoping you can put to use after this presentation. So some important facts about anxiety and depression in ASD. Anxiety is one of the most prevalent co-occurring symptoms in youth with ASD. So there's been a lot of research into anxiety and ASD, and that being one of the components of ASD, it's very difficult to separate out what is an anxiety disorder and what is just a normal anxiety that comes along with ASD. So the research is kind of all over with the percentage of individuals that suffer from anxiety that's above that usual anxiety that you would expect to see. And the research shows anywhere from 11% upwards to 84%, with most of the research agreeing on the closer to that 84%. In the general population, it's 18%. There's definitely much more research and into that. So it's a more certain amount or a percentage. Also, children and teens with ASD are 4 times more likely to experience depression. This is very important. So, this is something I'm going to be going into more detail about. It's very important to recognize these symptoms of depression and just have on your radar that some of the things that, and I'm going to be talking about it more later, but some of the things that may even appear more in line with behavior issues could actually be depression. Children and teens with ASD often do not display typical symptoms of anxiety and depression. This is really important as well because oftentimes, again, it can present much differently. It can present in behavioral issues. I'm going to be going over that with you, but it just wanted to discuss it going in so that you pay, it's just on your radar that some of the things I'm going to be discussing may sound more like behavioral symptoms or problem behaviors when that stem from ASD, when actually they could be stemming from the anxiety and the depression. Depression and anxiety and ASD can place youth at greater risk of social isolation, which is also, as you know, a big issue with the ASD population, with many individuals, both children, teens, and adults, experience that social anxiety. So it can cause even a greater risk of social isolation, and it can also cause a regression in level of functioning. And that, again, I'm going to be getting into more. Depression and ASD is associated with suicide attempts. That's also another very important area I'm going to be talking a little bit about. I also have some resources I want to share with you that are in one of the slides. So talking about DSM-5 anxiety disorders, and that's the diagnostic manual that clinicians use to diagnose anxiety disorders. I did, before I get into describing what they are, I wanted to talk a little bit about normal anxiety. So normal, it's very important to start to understand what the difference is between the normal anxiety, which is something we all feel at certain times, and when, as more of a natural reaction our bodies have to a stressful event or situation, knowing everybody feels anxious, at times, and kind of normalizing that for students as well. But also understanding that when the feelings of anxiety are extreme, so you might be noticing extreme, behaviors or acting out emotions, and we're going to talk more about this, but just again, knowing that extreme rather than the usual anxiety level that you would expect to see in somebody with ASD. Not that there's, one type of usual anxiety. I know it's different from person to person. It's very individualized, but knowing, that when it goes into an anxiety disorder, it's not so much that normal anxiety that we all feel. It's beyond what someone with ASD may be, have on a day-to-day basis that you might be noticing. It's when it increases to an extreme level, it may last longer than typical. And most importantly, in order to give a diagnosis, what we as clinicians look for is that interference with daily functioning. So just having that, understanding, I want to get into what the actual anxiety disorders are. So the first one is general anxiety or generalized anxiety disorder. It's called GAD, sometimes referred to in something you might have heard before. This is when a student or teen, child, or even adult experiences excessive anxiety and worry, and it causes significant distress. So again, looking for that impairment in important areas of functioning as more of a, okay, this is something we need to diagnose rather than this is an elevated level of anxiety that's maybe going to go away, and it's not a daily occurrence, but something that you're seeing more often in the classroom, especially a wide variety of everyday tasks or environments is where you might see this with the students that you're working with. You might see it as a particular worry about school performance. You may see it in like a struggle for perfectionism. It shows in very different ways according to the individual and how they're, they portray their anxiety. Social anxiety disorder is another big one. This is fear or anxiety about social situations. This makes it very difficult. I mentioned at the very beginning in the last slide that the social situations is an area where those with ASD struggle anyway. So sometimes it's very difficult to understand what the difference is, but this again, goes beyond the fear that you would expect or beyond the anxiety level you would expect to see in social situations. And it oftentimes happens during social interactions, the meeting of new people, the fear of being observed, thinking people might think what they're saying is wrong or they're not saying the right thing. So it could be, if they are answering a question in class, they could be eating in the cafeteria and be extremely anxious about people looking at them. They can, they worry about anything that's tied in with a social type of setting, but also being aware that this could also look or show itself in the way that they are in class when they are called on. And so excessive self-consciousness, making it difficult for them to participate in class, but also to socialize with peers. So panic disorder, you probably heard of panic attacks or anxiety attacks. And so the panic disorder is when someone has those panic or anxiety attacks quite often. So sometimes people will have them occasionally. That wouldn't meet criteria for a panic disorder. The panic disorder is more like several episodes of that sudden intense fear, and it triggers physical symptoms. So physical symptoms might be difficulty breathing, could be headaches, stomach aches, and maybe not. Some children and teens do a really good job of hiding those symptoms. So it makes it even harder to understand that's what they're going through. But there usually are some signs that you can pick up on when a student is experiencing a panic attack. Specific phobias, this is an extreme fear about a specific situation or thing. And it can cause some of the same feelings that a panic attack causes. So those physiological episodes of heart pounding, maybe difficulty breathing, they can feel lightheaded or dizzy, they can shake, but it's all when they're going to be exposed to that fear. So if they fear, a common fear is to hear about insects or, like spiders or, maybe animals, like some students might have and you won't see this, of course, but this is outside the classroom, and oftentimes these are the things that kind of trigger that phobia to hit. But it also can be, things such as what I described before in the social anxiety. The social anxiety can actually trigger a panic attack. So if there's a specific fear of being in front of class or talking in front of class or any kind of irrational fear that they take to the point where they're actually going to have, they get themselves so anxious, they actually have that panic attack. And that's the specific phobia. And again, the very common ones: heights, flying, animals, insects, receiving an injection, seeing blood, which are not necessarily things you'd see in the classroom. But it can, just so you know, can be surrounding any kind of fear. It's just an irrational fear of something that triggers this. Also, the separation anxiety disorder, which is a huge one with students with ASD, developmentally inappropriate and excessive anxiety when separated from parents or caregivers, excessive worry and fear that harm may come to them when they're not with them. Illness, injury, or death, or might come to the student if they're not with their parent or caregiver or major attachment figure. They can be worried about being separated from caregivers throughout the school day. They can also have a very, very hard time at school drop-offs and just throughout the day. So just to know that may occur on a lower level, but if it's diagnosed as a separation anxiety disorder, it's pretty excessive fear. So all of these things that I'm describing are more of that excessive. So not what you would typically expect to see. It's outside of what makes sense. Like, this is irrational, it doesn't make sense to me. And that's when, clinicians, as well as, educators, it kind of comes on their radar that something is not right here. So how anxiety may present in students with ASD. This is another very important area to discuss because oftentimes, though, anxiety can present the way it does in a more typical, neurotypical student, it can also present in ways that aren't expected and may look like something much different. So, and it is hard to sometimes split, understand what is coming from the ASD and what is coming from maybe that excessive level of anxiety, but just understanding that all of these things could happen as a result of anxiety is really important. So anxiety may present with different features at different times in the course of ASD, in association with different demands and in different environments. There are 3 components of ASD, anxiety and ASD. So you might see behavioral, physiological, or cognitive. So cognitive is that feeling of worry or fear. Of course, the behavioral, I'm going to talk a little bit about that, and even the physiological. So some of the symptoms you might see are changes in mood. You might see irritability. You might see anger or fear. Kind of going along with those phobias we talked about and the different anxiety disorders, in line with some of the symptoms I shared. It may appear as restlessness. It could appear as changes in behavior. So it might look like aggression. It could look like self-injury, or if there's already these things in place, it might be an accelerated rate or something, again, that you are kind of questioning, like, okay, what's going on here? This isn't how they used to act. This is, much, they're much more aggressive, or the self-injury is more often. So regression of previously learned skills is another big one. To make sure, again, this is something that, I'm going to get into a little more with depression as well, but something to have in your mind, and not be quick to think this is the student not wanting to do something. Sometimes it's that they can't, so they start to lose, some skills. You might see them using self-calming behaviors more often, stimming more often as a way to kind of try to deal with that anxiety. It's a way to self-regulate. Physical symptoms such as the rapid breathing, it might be a stomach ache. They might complain of headaches. Might ask to go to the nurse often. I have a stomach ache. You might see that, several times a week. I have a headache, the physical symptoms. They may talk about their worry or fear. They may not, but several, oftentimes they do. So the fear gets so high, or the anxiety is so high, they feel like they need to talk about it. So you may, even see a perseveration regarding the worry or fear. And defiance is another area which is pretty common. And it's not defiance because they want to be defiant, but it's more of like an agitation, because that depression, that anxiety level, or if they're experiencing depression as well, might be so difficult to deal with that they start to become very agitated, and it appears as being defiant. You might see perfectionism. So you might see a student having difficulty finishing an assignment because they don't feel it's perfect. So they're going over and over to try to perfect it. This is very common. It's a way to kind of feel like you're in control. The only control, when you're out of control with feeling so much anxiety, sometimes the only control you have is something you really latch on to, and it can show itself in that perfectionism. Avoidance, refusal to participate in classroom activities, especially when a student maybe was participatory in the past and now is refusing. Or it might have been something they enjoyed in the past participating in, and they're refusing, or they're not open to participating, or if they are participating, they're kind of hanging back and not really showing like they're involved. Distraction is another huge one, that inability to concentrate. especially because this oftentimes looks like ADHD. So I have a lot of clients that I work with that have this distraction even in sessions. So kids and teens that I work with, they have very difficult time concentrating on the skills that we're discussing, and they have to continually be reminded, or they have to take a break. And so we'll get into some of the strategies later on, but just, again, to kind of talk about that, as it's really important because it may not look like anxiety. The need for reassurance is a big one, so that, kind of questioning everything they do, and that need for reassurance so they can move on from it. You might see meltdowns, which again is, that a big one with ASD, not knowing, is this the ASD, is it anxiety, what's going on here? But it can be both. So, certainly can be the ASD, it can be anxiety, but when they both combine, you'll see most likely more frequent meltdowns. So that again is, an area to be very aware of, that some of these behavioral pieces might actually be happening because of an increase in anxiety. So in the physical symptoms, in addition to the ones that I stated, it can also show up as GI problems or sleep problems. You might see a student falling asleep in class, or they're very tired. That might mean that they, didn't get enough sleep, or they're not able to sleep well. And the stomach problems are a big thing. Again, I know gastrointestinal with students with ASD is something that's on, that we're all aware of, is a high prevalence of showing those or experiencing gastrointestinal symptoms. But again, this would be an acceleration or the typical behavior that you're used to seeing in your students. It may increase, and again, it most likely will result in them asking to go to the school nurse. So those, keeping all of those, or at least being aware of all of those different pieces that can actually happen as a result of anxiety, is important. So when anxiety goes untreated for a long period of time, it can lead to a diagnosis of a depressive disorder. And not that it's always the case, but that is something for all of us to be aware of. It's something that I see often in the clients that I work with, the teens and the children, that if the anxiety isn't under control, it oftentimes shows up as more of a depression, and it can be, some symptoms of depression or being depressed, or it can go into a full-blown diagnosis of a depressive disorder. So talking about what depression impacts is really important. So it impacts social, emotional, behavioral, and cognitive pieces. Also, as with anxiety, anxiety can be on its own. It can spill over and then become a diagnosable disorder. Depression is the same way. A student can be showing some signs of depression or feeling, having some of the symptoms, but when it, spills over, when it gets to that level where you're maybe noticing students and you're worrying about them, and I'm going to talk about the way it may show up in the class, but, going over some of the depressive disorders, just to have, general understanding of what could be going on when you're seeing students and might be, thinking, oh, there's something wrong. Something doesn't seem right. They seem sadder than usual. They seem, there seems to be something that we're not understanding here. So the depressive disorders, the major depressive disorder is intense episodes of depressed mood, loss of interest in previously enjoyed activities. You may see weight loss or weight gain. You may see, again, as I mentioned, like a very sleepy student, a student that seems to be falling asleep, a student you might have to cue to pay attention often. It might show in a different way that they're very awake and where they normally weren't, and they're very, and I'm going to talk a little more about that in the bipolar disorder, but that is something to know, that it could either show itself in that extreme tiredness, but it could also show up as more of a kind of as I'll talk more about, but more of a hypomania, or we call in practice, or, that hyper arousal, fatigue, just a general low energy level throughout the day, feeling of worthlessness, diminished ability to think or concentrate, which is, in the classroom is a huge thing, and you would see that. Suicidal ideation, I'm going to talk a little more about that in the next slide, but that's also something to be very aware of. And bipolar disorder, that's where there's, and this was called manic depression. You may know better by that term, but now it's called bipolar in the diagnostic manual. And this is when a student might experience both those major depressive episodes or symptoms that are in the major depressive disorder, but they also might experience an emotional, what we call an emotional high, or a mania, or even a hypomania. So a mania is more of an extreme high where there might be a lot of energy. You might hear like pressured speech, like they can't, they don't stop talking. It's it's very noticeable when someone has pressured speech. So they're talking so fast, like their motor's going too fast, and they can't stop it. So it could be that, or it could be a hypomania where it's lower than what a full-blown mania is, which is that extreme pressured speech or extreme high mood. It's more of it's still a change from the lower mood, but it's not as high as what we would consider a mania in clinical practice. So you might still see those depressed symptoms of sadness or emptiness, hopelessness, but then you'll also see an elevated mood. And again, it may be very expansive and, be it full mania where you're saying, oh my gosh, they were just, very low key and teary and sad, and now they have all this energy and what's going on. So it could, exhibit like that, but it also can exhibit like going from that teary, sad, quiet to being more active and being, being active enough or talking enough where you still have on your radar, okay, what's going on here? They were, there's a pretty extreme change in moods, but it's not that where the motor can't stop and the speech is so pressured. So just knowing that there's two bipolars, as bipolar 1 and bipolar 2, and that's why that kind of explains the two different types of bipolar, where one is more of that extreme change and the other is still a change, but not to that extreme level. You might see like an inflated sense of self-esteem when it happens, where previously they weren't, they were exhibiting poor self-esteem. And again, that sleep comes into play with bipolar. So it may exhibit itself in, the being very tired in class or being very hyper aroused, depending on how that student is affected. Disrupted mood regulation disorder, that's a severe recurrent temper outbursts. So you might see like a verbal rage, physical aggression, and it's very inconsistent with developmental level. So it doesn't really quite fit with the diagnosis of ASD and, where they are developmentally. It's beyond that. So again, keeping on your radar that these disorders that are, when they're actually diagnosed, that is a very high level, more than what you would expect to see. And most likely you're going to have something that kind of triggers you to think, okay, there's something not right here. So the persistent depressive disorder, the dysthymia, that's a chronic depressed mood. It usually takes place for 2 years or longer. So if you think about the major depressive disorder, it does include some of the same symptoms, but it's a much, much lower level. So you might see students that are just kind of flat affect. So maybe not very expressive, or, when they talk, they're, very low, their voice is very soft, or they don't, avert eye contact. Again, kind of bringing into play those, what are the ASD symptoms compared to, a depressive disorder or an anxiety disorder symptoms. But it's kind of an accelerated or exaggerated symptom, than more so than just what you would typically see with the ASD diagnosis. But again, the persistent depressive disorder does include a lot of the things that you see in major depression, just a lower level of it, but the insomnia, the fatigue, the possible low self-esteem, the poor concentration, and feeling of hopelessness are still there. So individuals with depression may have a great deal of difficulty completing tasks, especially when they're challenging tasks. You're most likely going to see that in the classroom setting. They may feel confused, they overwhelmed, they may get easily frustrated. Even very basic tasks that maybe they were okay with in the past become very difficult for them. And again, that irritable feeling with all the depressive disorders is something, that most students will feel, that irritability, the agitation, anxious, the inability to focus. You may see that they're no longer interested in things they really loved to do in the past, or, take part in, whether it's activities or hobbies, or, learning of new things. So how students with ASD, how depression may present in them can be much different. They can present the very typical signs of depression that we would expect to see in neurotypical students, but they may also, just as with anxiety, they may present with much different behaviors that appear as if either it's, the ASD behaviors accelerated or worsening. I'm going to go over some of the things to kind of look for, but just to, understand that I know it's very difficult to kind of parse these out, what's the ASD, what's the depression, but making sure that it is kind of on your radar when you're viewing a student, because it can oftentimes exhibit as if the student is not wanting to participate and trying to be oppositional when actually they're having a very difficult time. So it could, looking for changes in mood, that increased anger, irritability, the sadness, the tearfulness, changes in behavior like decrease in self-care and hygiene. They may come to class kind of disheveled, their hair may be a little messy. Regression of previously learned skills is another big one. So, what's happening here, they had these skills and now they're not able to, use them. That's something to certainly be aware of. The increase in stereotypical behavior usually becomes a problem because they're trying to self-regulate. They don't know what to do with those feelings. Decrease in restricted interest. So, what definite sign when you have a student who's, maybe perseverated or certainly, talked and made aware that this is their interest area, and then all of a sudden they're not, as interested, they're not talking about that area of interest, and they haven't gone into another area of interest, but they're, decreasing or restricting that behavior. That's, certainly that's a sign, a red flag. Well, loss in interest in previously enjoyed activities. Again, in classroom, this could look like, activities or assignments or, something that they were really looking forward to and like to be a part of, and now all of a sudden they don't want to, participate. Decrease in motivation, Need for reassurance. So that, again, as with anxiety, they may look to you to reassure them that they're okay, that things are going to be okay, that, their work, the level of work they're doing is okay. So that continual need for reassurance, the lack of confidence, which certainly leads to that need for reassurance. So they start to question everything that they're doing. Am I okay? Am I good enough? Is what I'm doing good enough? And they may kind of look at everything through that dark cloud, that depression. I like to, talk to my clients about, especially my children and teens that I work with, about how depression can kind of be a black cloud over your head and color everything you see. So even though it doesn't make sense that, they may be doing a great job and maybe wonderful students, but they're still, questioning, am I good enough? Am I doing well enough? I'm not doing well enough. You might hear them say, I can't do this. And when they can. So that could be the depression. Indecision. So depression for children, teens, and even adults really creates a problem with indecision. So even if it's very simple, you can choose this or you can choose that, they may have a great deal of difficulty choosing between two things. They may complain about body aches, headaches, and stomach aches, as with the anxiety. They may ask to go to the school nurse frequently. They may have changes in appetite. You may notice it as weight gain or weight loss in the class. You might, see, wow, they're really putting on weight, or wow, they've lost a lot of weight. Again, that lethargy, the low energy is a big thing, as with anxiety. And social withdrawal, which again, and I've mentioned a few times, that's a huge red flag. It's beyond the typical social withdrawal that we see in students with ASD. So this might exhibit in, that's something that they normally enjoyed and they weren't so anxious about, but now they're not, they're withdrawing. So depression and suicidal ideation in ASD, it's so important to have suicidal ideation on your radar, especially when a student is dealing with depression or exhibits symptoms of depression. And by suicidal ideation, I talk about, what I mean by that is thoughts that they might be having that they don't want to live, a plan, they actually, that brings it to another level. They might be thinking of ways to kind of end the pain. And this might not be something that you're aware of, but sometimes when students are depressed enough and they're feeling this suicidal ideation, having thoughts or thinking about a plan, a suicidal plan, they'll have red flags, or they'll share it with you, or you might just be really concerned about them, and it might come out if you start to talk to them. And when you might ask, is everything okay? It could then come out. Depression is the strongest single predictor of suicidal thoughts or attempts among children with ASD ages 16 and younger, which I think is something that there's not enough awareness surrounding. In 2014, suicide was the second leading cause of death for young people ages 10 through 24, according to the Centers for Disease Control. And this was for all youth 10 to 24. It was the second leading cause of death. So that kind of, informs to have this on your radar with all students, not just students with ASD. Percentage of children rated by their parents as sometimes to very often contemplating or attempting suicide was 28 times greater for those with ASD, according to a study in research in autism spectrum disorders. So it makes a case for this being something very important and something for us all as clinicians, parents, educators to have on our radar so that we can prevent suicide. And I did create a slide at the end of the presentation, and it includes a lot of resources from not only the CDC and the NIH that are guidelines for educators. They're created specifically for educators. You can print them. They have great charts and material that you can share. And the wonderful thing about it is created for the school setting. I've also included some great resources that are more local, so agencies and different numbers and support and resources that are more local. So I hope that you will take the time, although I won't have the time to go over everything during this presentation, that you maybe at your leisure are able to go back and take a look at some of the resources so that you can kind of raise your awareness and know what to do if you do question, is the student, depressed, and is their depression getting to a point where I need to be concerned about this? So I do hope you utilize those resources. So I wanted to talk about some possible IEP and 504 educational accommodations that are really helpful for students with ASD who experience anxiety or depression. Behavior management plans are huge. That prevents a lot of the anxiety that is tied in with a lot of things that you're going to see in the classroom, and again kind of speaks to what is the behavior issues that they're already dealing with that are tied in with the ASD, but now taking it to another level. What can we incorporate into these behavior management plans that speak to the anxiety and or depression the student may be experiencing? Advance notice of change in routine is so important, particularly when there's anxiety and or depression added onto already challenging, something that's already a huge challenge for students with ASD, the change. Extended time for tests and exams, prearranged breaks, preferential seating, identified safe space within the classroom. That's a big one. If you do have somewhere in your classroom, and I'm going to talk about this a little bit more in the following slides, because it's a very helpful piece of actually coming up with a strategy to help students. But finding a place or identifying a safe space in the classroom where students can kind of go, and whether it's just to compose themselves or they can't, be at their seat anymore, just something where they can go for a decided time that they can, if they're having a struggle, this is what you can do. You can go, this is the first level kind of thing. Like if you can't handle or you can't manage your symptoms, maybe stepping away from desk and going to the safe space is an option. Identified supervised space outside of classroom, really important. So if symptoms get so out of control, the students can't, they just can't be at their seat anymore, where can they go? Prearranged again, so that, in the moment, they already know, and there's a plan. So the exit plan to be able to leave, to go to their supervised safe place, if they're unable to manage the symptoms, is very important as well. And a team approach. So contacting the school team, whether that's school psychologist, whoever it is on the team, ESE coordinator, parent, caretaker, and clinician to, so the parent, caretaker, you understand what's going on at home. You want to keep things consistent across all environments if possible. If there's something that's working at home to help manage the anxiety and depression, can it be incorporated into classroom strategies? Clinicians, if there's a release, maybe talking to a clinician, or, having them share what helps the client, their patient, so that you can also incorporate that and they can know what to work on as well outside of the class. A couple other things that could be really helpful. So accepting late work, allowing students to give a presentation on their own rather than in front of class if they're very extremely anxious, especially if they have that social anxiety. Breaking down assignments, and having a class buddy. Those are all things that can be very helpful. So now we're getting into the strategies to support the students who have ASD and experience anxiety and depression. Some things that are really helpful in the classroom, communicating empathy, just letting students know, that you understand that they're struggling, that it is, they are having a hard time. And so just that empathy can go a long way towards helping them get through, because they can be struggling a great deal, whether it's with anxiety, depression, or both. Maintaining structure is so important, as all of you know, especially with ASD. So you add the layer of anxiety and or depression on, maintaining that structure becomes even more important, because if you don't, it can cause or trigger that anxiety or depression to worsen. Reminding the student to use coping strategies. I'm going to go over some strategies with you today. Reinforcement for utilizing the coping strategies can be really helpful. Regular check-ins, sharing concerns with the team members, as mentioned in the previous slides, making sure that other people on the school team, as well as parents or caregivers, are they're on the same page with you, what's happening in the classroom, and what's happening outside of classroom. If there's any concerns, that open communication is so important. So with students who do have a great deal of anxiety and may have depression or exhibit some symptoms of depression, it's really important to talk privately with them. Calling attention to their anxiety in front of class is something that can cause them to, shut down. Teaching the students techniques that they can use is very empowering for the student. Talking with parents about what techniques they may use at home, again, as I mentioned, to try to incorporate them is very helpful and can be very helpful. Also discussing alternative ways of handling situations. If a student does have an anxiety or a panic attack triggered, what could be done differently next time is another, area to consider. So getting into the actual classroom strategies, I'm going to be going over several briefly, but I'd like to spend a little more time on a few of these. I know I don't have time today to go into detail with all of them, but I do want to, at least give you something in more detail that you feel like you can maybe take from this training and put into use. So visual supports are huge. I know you've heard of the subjective units of distress scales, the 1 to 5 scales. Those can be really helpful when dealing with or helping students build plans with how to deal with their anxiety and or depression. So when a student is feeling anxious and they get into that, anxious mode, it's really difficult for them. Their brains don't function as effectively. So it's really important to do this before. So be very proactive with it and have a plan in place. So what the SUD scales do is inform a plan. So whether you decide you want to use a 1 to 5 scale, a 1 to 7, or even a 1 to 10 scale, if you want to use a thermometer, even if you wanted to add in a 0, because oftentimes students who do struggle with anxiety and depression will have a really hard time of identifying when they don't have any anxiety or having any symptoms. You add a 0 in and just as a goal that they can work towards, but this is where you are on 1 to 5. So what I'm saying is whatever works, for you and the student. There's no perfect scale, but the scales are so helpful. So, it allows the student to provide information to you once they identify what their feelings are, but it also, then you are more aware of what's going on at these different levels, and also can be shared certainly with parents and caretakers. There's student stress plans that are informed by the visual support. So I'm going to go over those in the next slides. And then the teacher student guided stress plan, which I'll also go over. So the student stress plan is strategies they can put into place, and they can do this on their own once they learn it. The teacher student guided stress plan is more for you to know this is what's happening with the student and at different levels of their different SUD levels, and kind of cues you to understand this is what's going on, but also allows you to kind of cue the student if you see they're really struggling. Positive statements and self-talk journals are really important. Calming strategies such as deep breathing, calm pictures, grounding techniques. I'm going to go over some of these. They're all, included in this training. Utilizing schedules, calendars, and social stories and timers are very important as well. So the SUD scales, just to go into a little more detail with those, again, there's no perfect answer to what type of scale you want to use. I prefer using the 1 to 5 just because there's, less, the student has to identify fewer levels. But again, the 1 through 10 is fine if that's, what you want to use. But regardless of what you use, sharing with the student that, 1 or the 0, whichever you choose, is the calm, relaxed feeling where they don't need any help. The 2 is feeling okay, mostly okay. I need to kind of monitor where I am, and teacher, as well, monitoring student. And of course, the 3, a little more nervous. I'm starting to feel some anxiety here. I need a little bit of help. For feeling pretty anxious at that point. And then 5 being, I'm going to explode. This is the worst that my anxiety gets, help. So just knowing that those are very important, and also that the goal is to prevent a student from reaching the 405, or 5 level. What can we do at 2 and 3 to prevent the reaching the 4 or 5? So going on to the student stress plan and how the SUD scale informs it. So once the student is able to identify what they're feeling at these different levels, then that allows to, create a plan, to create tools. And this can be called a student toolbox, whatever you want to call it. It's a plan. But if you want to cue students, you can certainly, call it their toolbox. You cue them to use their toolbox, whatever you feel comfortable with. So what the purpose of this is to take that SUD and put it into a plan. So you have a proactive created plan so that when a student begins to feel that anxiety or depression symptoms, getting out of hand, they know what to do. And hopefully, again, the goal being, let's do something before you reach a 4 or 5. So some of the examples here, I'll skip over to 1, I'm feeling a little anxious. I can take a couple deep breaths and focus on my work. Starting to have trouble. At 2, I can take some deep breaths. I can look at my positive statements and my grounding key ring, which again, I'm going to go over, or my calming pictures. 3, I feel frustrated and angry. I need time out to reset. So it could be deep breathing, calming pictures, positive statements, the grounding techniques. And then, when you get into 4 or 5, that's when those classroom safe spaces, or even the outside of classroom safe space, come into play. And your student may need to leave their desk. They may need to go and do some deep breathing. They may need to look at their, positive statements or their calming pictures before they can return to their desk and be okay. So of course, 5 being I'm freaking out, and that's where you consider that outside of classroom space as being, a helpful place, because the student can no longer control themselves within the classroom. So the teacher-student guided stress plan, this plays off of what the student created in their own plan and allows you to understand what's going on from your perspective, what you're observing in the student based on what they shared on their SUD that informed their plan. So one, frustrated, angry, and knowing to monitor for distress allows student to look at their student stress plan or their student toolbox and utilize the tools they've chosen. And they may be agitated, and you may want to consider not calling on them to answer questions when you're noticing that they may be agitated or more anxious. You may want to cue them to use their toolbox and use their calming strategies. And as we go up the scale, of course, getting to 5, that leaving the classroom to calm down, so they can go to a designated safe space outside of the classroom and be, that's monitored. It might be at the school nurse. It might, be something that's created through the IEP or 504 where there's, somebody in the ASD department or, whatever it is that's predetermined. It's important to, discuss with the student, and everybody is in on how this plan is going to work. So if they do reach that 5 level, that you're just cueing them to leave the class. There's already a plan of what they're supposed to do and where they're supposed to go and how long they can stay there and when they're gonna, that they do have to return to the classroom after that agreed upon time. And all of this can start with a student meeting, meeting them before or after school to come up with this plan. And it can be that you give them the SUD scale and they work on it at home and bring it back to class. And then you have that student meeting with them. It can look a lot of different ways, but it is important at some point to meet with the students so that you can come up with these, understanding their triggers, understanding what they look at like at different levels and what they're actually going to be using, what they're allowed to use when they may be feeling anxious or depressed to self-regulate. And that's the key here, is really to teach them what they need to do. So some of the techniques I wanted to go over, grounding techniques. Now these are so helpful, not only for children and teens, but also for adults who experience anxiety and or depression. They can get to a point where anybody can get to a point where they're so agitated or anxious that you might, notice that they're zoning out. So I hear that a lot with patients I work with. I zone out. I'm in class and I'm zoning out, and I don't know what to do. So these grounding techniques, and they are available. These worksheets are available for free, and they're great at therapistaid.com. Grounding techniques can bring you back from that zoned out feeling, and you do it by utilizing your senses. So what you can taste, what you can smell, what you can hear, what you can feel, what you can see. So that's all very important. It's a pretty easy way to kind of bring yourself back to, or for the student to bring themselves kind of back from that zoned out feeling. And it's easy to teach this, and it can be done in a couple different ways, and it can even be created in a keychain type tool for them. But this is something really important for them to be able to kind of bring themselves to a place of being okay when they're reaching those higher levels on the, or even the mid levels on the SUD scales. So another one, body awareness, another grounding technique, and it talks about taking deep breaths and different things that you do, like clenching your fists and pressing palms together, kind of to get out of that zoned out feeling when that anxiety gets too high. So I wanted to take a minute here before we go on and thank you all for participating in the webinar. and also let you know to obtain a certificate of completion. You must fill out the form at the certificate of completion link provided on the email for this training. And please to write down this code as it will be required to receive the certificate. So the code is DAB 122021. Again, one more time, that's DAB 122021. So the grounding techniques can be made into a grounding key ring, as I call it. There's a free template for this, and I provided the information and a link in the reference section. So this can be really helpful for students, again, with self-regulation. This is before they need to leave classroom and hopefully prevents them from needing to leave classroom. It just reminds them these are the things to do to kind of bring yourself, again, from that heightened anxiety, anxious type zoned out state. There's the positive self-talk journals. Again, you know, there's information here of where to access them. It's free. It can be very helpful for students. There's a link again in the reference section if you want to go straight to it. This can be really helpful for students when they're really feeling those depressed feelings and feeling overly anxious, to kind of focus, and it's based on cognitive behavioral therapy of getting, you know, having those negative thoughts kind of overcome you, is fighting against the negative thoughts by adding something positive in and reminding ourselves. And, you know, it's good for children, for teens, but also even for adults. It's used with the adult population to fight against those negative thoughts. So anything that they can have that's positive that they can look at, whether it's, you know, their own journal that they create, lists of affirmations, list of positive self-talk, I call it, or you can use this template and they can fill out the template and bring it to class. And when they're feeling anxious, they're going to refer to it. And just to back up a little bit, so in these plans, these anxiety plans are our student stress plan and the teacher student informed stress plan. It actually, in the I need, it sets out as after you go through this with students and they choose what they're going to want to use, they can put it into their plan. So their plan would, I feel like I'm frustrated and angry. I need to do my deep breathing. I need to look at my calming pictures, my positive statements, or my grounding techniques. So also deep breathing. I won't go too much into this, but I will let you know, again, therapistaid.com, free printable worksheets are very helpful. I have a link at the end of the presentation, but it's definitely helpful for students and a great thing to incorporate into their plan. Calming pictures. Now these are pictures that a student would bring from home, or, you know, something that makes them feel good. It could be a picture of their pet. It could be a picture with their friend. You know, anything that kind of calms them down. And this is known to work very well, not only for children and teens, but also for adults. So a lot of the adults I work with who experience anxiety and are maybe in a work situation and feel that acceleration of anxiety, this is a kind of a way to ground them away from those anxious negative feelings into, this is what makes me feel calm. This is what makes me feel good. And, you know, being able for the student to be able to pull these pictures out, whether they're in a keychain or they're in their backpack, wherever they keep them, you know, if this is one of their tools that works for them, it's really helpful for them to be able to access these pictures when they're feeling very anxious. I also wanted to include some great tools that are created for educators. These are from Teachers Pay, teachers.com. I have more information in the reference section. The My Emotions check-in is wonderful. There are all types of charts. They're 1 to 5, 1 to 10. very similar to what I included here in this training, but very helpful things for you to maybe kind of explore and possibly consider using in the class. So here's the reference section, and where you'll find a lot of that information on the different tools. And that is the end of this webinar. I want to thank FAU Card so much for having me here, and also to thank all of you for watching. And I really do hope that some of the things I discussed today are something you can put into use and makes things much easier for your students as well as for you. Thank you very much.